speaking about some of the interventions that we have put in place on the ground. And once we have, and you know, the ones that need to be reinforced and so forth. And once she has discussed that, then Moses will speak, will respond basically from a student's representative point of view to say, you know, what is the take from a student's body perspective. And then after that, we will then go into the testimonials. So on the agenda, we have the testimony of our staff member first, Olisa, and then would be followed by Ngobi, who's a student who will also give a testimony, and then we'll open it up for discussion. And when we are going to discuss, then I'm hoping that we can talk about what has been presented, but really come back to some of the challenges that people are facing that we need to attend to in how we can support people better to engage with prevention measures, and then also talk a little bit about what happens now that you know, the university is going to close, the residences are going to close, people are going to go home, and that kind of carries the risk of taking transmission into households or communities. And when the universities reopen, the students will be coming back as well, and there's also the possibility of you know, bringing transmission back onto campus. So we kind of have to then get to a point where we discuss the challenges around that, and maybe if we end up with some sort of concrete suggestions around activism around those, and those are great.
Or is it
That's how I understand it, Norma, in terms of the overall plan.
Okay, no, thank you. I think that's what we actually discussed. Thank you for that. I think everyone here do understand the part, and I think we are going to open up now. There will be a banner that's going to be put up, Rakshika. And
yeah, can I just ask? Can I just ask the Jabu if you could just move your screen a little bit forward so you're not cut off. You're a little bit cut off. So just move the screen a little bit towards. Yeah, that's actually much better. Okay, so I will start share the screen and start the webinar now, and let people into the webinar. You good with that, everyone?
Yeah, sure. Yes. Norma, just to let you know, Norma, that you're also doing a vote of thanks at the end, right?
Yeah, sure. Thank you.
Yeah.
Just to check, sorry. Do we turn our videos off when we're not speaking? Yeah.
Yes, please. If that's okay with y'all. Okay. Let's start this.
We're not getting. We're not getting Richard. Is it me?
No, he just said that the videos, that's all.
Good afternoon, everyone. Thank you for joining us this afternoon for this webinar. I would like to acknowledge our panelists, Professor Mashabela, Dr. Msomi, Dr. Lesov, Sister Jabu, Mr. Gambako, Dr. Majola, as well as Mr. Msezan is going to join us a little bit later. Thank you so much, everyone, for being here this afternoon. Greetings to all participants, our staff, our students, alumni, and all other guests. The world is faced with the unprecedented challenge of COVID-19 and mitigating its impact on people's lives. It has claimed hundreds of thousands of lives across the globe, including South Africa. UKZA, unlike any other institution across the country, has strived to limit the spread of the virus among its community through various activities and campaigns that included encouraging physical distancing, observing health and safety protocols, and through virus information webinars that we've been hosting since March with our world-renowned experts in the field. As from the 1st of December, which was yesterday, the country recorded 2,302 new positive cases, while 58 more people lost their lives due to this deadly virus. This brings the total number of cases since the outbreak to 790,004, while the death toll stands at 21,535. At UKZN, following the recent COVID outbreak, student outbreak, 50 positive cases were confirmed in students living in 11 different residences between the 22nd of October and the 27th of November. It is extremely distressing for the university, as we have taken every precaution to ensure the safety of our students and staff. We can, however, not do this alone, and this is why we're here today again to speak to the university community and make sure that everyone understands their role to play in this. We remind everyone again, despite that we are on level 1 lockdown status, we cannot let our guard down. Prevention is always the key to containing the pandemic, and it's essential that we take care of our health and protect ourselves and others. With that being said, today's webinar is very, very important, as it should examine how we can collectively deal with the pandemic and how we can protect one another. During this time of uncertainty, it is important that we all play our role to help control this pandemic and stop the spread of the spread in our communities. As we know that we are reaching the festive, we are approaching the festive season, and people will be going to various areas, and we don't want people to take the virus with them to their communities. I mean, we also don't want the people to bring back the virus to the university when they come back after holidays. So we all need to make sure that we celebrate responsibly and make sure we keep to protocols and don't drop the ball, because the virus is here with us to stay. Okay, again, welcome everyone. So before I hand over to our facilitator this afternoon, Professor Mashabela, I would like to introduce him briefly, and then he will then introduce our speakers this afternoon. Professor Mashabela is currently the Dean of the Dean and Head of School of Nursing at UKZN. He is a Chief Medical Specialist and holds the position, he is a Chief Medical Specialist, and he is an adjunct faculty and Wellcome Trust Research Fellow at the Africa Health Research Institute in South Africa. His research portfolio in implementing science and health system research cuts across multiple disciplines and involves the design and implementation of evaluation of complex interventions in public health services and programs, and overall seeks to improve access, quality, and equity in healthcare. So he will be taking us through the program this afternoon, and he will then introduce the rest of the panelists. Thank you so much, Professor Mashabela. Over to you.
Thank you so much, Ms. Zondo. And I also appreciate the opportunity to be invited by your division to help host this webinar. And with me, we've got a number of panelists who are going to be sharing some wisdom and evidence and data and making arguments and sharing knowledge with us this afternoon. We at UKZN, we were one of the first, if not the first university to set up a campus-based war room in an effort to anticipate and curb the risks that COVID-19 was bringing, even before we had the first case of COVID-19 in South Africa. And, you know, because of the work that we have done, UKZN is one of the universities that prepared best for campus cases. We went to great extent to build the foundation and the pillars for campus response. And going forward, especially when the students were returning, the whole College of Health Sciences was mobilized to try and support campus health as a whole on campus, including the services that were provided by our occupational health services to really prepare the campus to cope with the risks. Much work was done. All the colleges in the university played their part in instituting protocols. And one can say that you know, the university put in place many measures to try and prevent the spread of COVID-19 and limit the infections and limit disease and the impact of disease on campus. However, in spite of all of those efforts, we also know that you know, the campus has also been affected by COVID-19, and we want to try and put that situation into perspective a little bit this afternoon, and review what it is that need to be done, as Ms. Zondo has already stated, going forward. And we know that we are also now at the beginning of a resurgence in the country, and it is also going to affect us. It will affect our students, it will affect our staff, it will affect our activities on campus. So we kind of need to negotiate and renew our social contract in terms of everyone playing their part. So let me not waste time and invite our first panelist, who is going to share with us an overview before we take a deeper dive into the specific issues on campus. And this is Dr. Nokanya Mdlalos-Msomi, who's going to be sharing with us an overview of COVID-19. And she has played an important role in helping us set up the UKZN War Room and participating in it. She was also one of the advisors of the MEC and the head of department in KwaZulu-Natal to support the provincial response. She's the head of virology, clinical virology at the University of KwaZulu-Natal, and she's also heading the laboratory, the National Health Laboratory Service in KwaZulu-Natal. She played an important role in helping set up testing services for the province and helping monitor the pandemic in the province. And we're very, very honored to have you, Dr. Msomi, with us today to share your views. And I'll take this moment and allow you to go ahead and share your presentation. Thank you.
Thank you very much, Professor Mashabela, and thank you to all the audience members who are with us this afternoon. My role is quite easy. I will just give a brief overview of what the current state of the pandemic is globally, and also bring it closer to home. And I'm trusting that people can see my screen.
We can see you for now. If you can share screen with students, we don't mind seeing you.
Okay, let me fix that. So I will basically give an overview of the state of the epidemic and the pandemic from the global perspective and bring it closer to home. And I would also try and share what we have seen as the patterns of the epidemic in our country specifically, and what the discussion points are in the country and globally on what the drivers of the resurgence of the COVID epidemic. So that is in a nutshell what the outline is. So generally, the COVID-19 epidemic, from what we know, is that it was first observed and reported in the city of Wuhan, which is in the Hubei province of China. And this was in December 2019. And soon after that, it spread out throughout the world, and the World Health Organization then declared it as a pandemic as of the 11th of March in 2020. And as of yesterday, which was World AIDS Day, the world and the country in particular was facing two current pandemics, which are hitting, specifically in our country, quite hard. And the global statistics currently are that cumulatively, the number of cases that have been reported worldwide has exceeded 63 million cases, with over 1.4 million deaths, which basically drives home the gravity of this pandemic. There has been a high number of recoveries, but the loss of lives has been just too much. Our country in particular, South Africa, is sitting at number 16 in the world in the number of countries that has reported a high number of cases. Bringing it closer to home, yesterday I think Mrs. Ondo had already alluded to that the confirmed cases in our country has exceeded 790,000 cases, which is very far and is the highest in Africa. The distribution is different in different parts of the country, with certain provinces reporting higher caseloads. But obviously bearing in mind that different countries, different provinces also have different population density, which then affects the proportion of the members of those separate provinces that are affected. Of note is that in KwaZulu-Natal, as recently as yesterday, we reported 309 new cases, and sadly 12 people succumbed to the virus. So what we have seen in the country since the arrival of the epidemic in South Africa, the epidemic was first imported, or the reported case was reported on the 5th of March in South Africa. And as you can see, the trend has shown a steady incline, peaking at around mid-year, from about the second week of June to the latter part of August. And this is what has been termed our first wave. A lot of efforts have been put on by our government with putting stricter restrictions with lockdown levels 1 to which later 5, 4, 3, which later is down as of the 21st of September to level 1. And with that, we have obviously noticed an increase in the spike of infection as community transmission set place. Fortunately, there was control achieved, resulting in a decline and somehow a return to baseline from about the latter part of August. And as we can see now, we are starting to report some resurgence in different parts of the country. This graph here tries to show what the trend has been in how the virus has evolved in the country throughout the provinces. What we observed is, even though the first case was reported in the province of KwaZulu-Natal, which was an imported case, a bigger epidemic actually set place in the Western Cape, which is the Western Cape province depicted here by that gray graph. We'll see that it was the first province that had a peak, which was just before the beginning of June, and this was closely followed up by the province of the Eastern Cape. We also seeing that mirroring of evolution of the epidemic now that resurgence has been reported in these two particular provinces. And it is for this reason that the rest of the country needs to be aware that now that we are observing a resurgence in both the Eastern Cape and the Western Cape, other provinces should try their utmost to limit the spread to their provinces and try and limit the devastation that we're seeing currently in the Eastern and the Western Cape provinces. Taking it closer to this month, and in the month of November, this graph clearly depicts what the two provinces are looking like as what we can say real outliers from the background prevalence that we're reporting in the country. The country currently sits at a positivity rate of around 13%. And although obviously that is a fairly high, but you're seeing that the Eastern Cape and the Western Cape are particularly higher. And starting in the first week of November, the Eastern Cape had a positivity rate of 29%, which exponentially grew to 31% and is currently sitting at around 35%. And that is, unfortunately, has been coupled with devastating mortalities that have been observed in that province. A similar picture is also appearing in the Western Cape, particularly in the garden route of the Western Cape. Obviously, there is some sort of close proximity and one may say a contiguous spread, and that could be the reason for these closely neighboring provinces to be observing this high rate of resurgence as opposed to other parts of the country which are fairly low. In KZN, we are currently sitting at a positivity rate of 6%, and that is a similar trend in the North and West. And Gauteng is currently observing the lowest positivity rate at 4%. But this being said, is obviously we have seen what has happened in the first wave of the epidemic, and the reason for having talks like this is to make sure that we do not repeat the sins of the past and try to cap the transmission going forward as we go into our holiday season and people will be traveling across provinces. In this picture here, this graphic tries to depict what, in a graphical manner, what the epidemics look like in these provinces where we are observing a resurgence. As you can see in the middle part of the year, around June, July, the Eastern Cape had a definitive peak, followed by a return to baseline, some sort of return to mortality. And this is expressed by what we call a reproductive number. A reproductive number basically means if one person is infected, how many other people will they transmit to or likely to transmit? And as a general rule, you want for an epidemic to be controlled, that reproductive number to fall below 1. And as you can see in the Eastern Cape, it did go down when around August, when the first peak had passed, and has since gone back to above that. A similar picture is being observed in the Western Cape, in that the reproductive number did fall down after the initial resurgence and is now slowly creeping up to above 1. And that is what we do not want. The picture is slightly different in a province like KZN, which is currently not yet experiencing a resurgence similar to what we're observing in our coastal provinces. We also worry that we are also a coastal province, and the movement tends to follow the coastal route. So it is concerning that with our close proximity to the Eastern Cape, and as holidayers move towards the coast, that we should be worried that we may not observe this lull in infection going forward if people do not change their behavior and we do not observe stricter measures to restrict transmission of infection. This picture tries to explain in the different regions of our province now of KwaZulu-Natal. We have different districts, and the districts that we have kind of behaved in a similar fashion, except for obviously eThekwini being because it's a cosmopolitan city, and it's a central area of business, and most people work in eThekwini province. That's where most of the infection have been reported. But generally, as a province, it has moved in a similar trend in that we are not yet observing a very high resurgence, even though eThekwini municipality or eThekwini district is reporting a higher number of cases by virtue of having a higher population density as well. So the question that we need to ask ourselves is, what is behind this resurgence that we are observing? Obviously, in the earlier part of the year, with higher lockdown levels and stricter measures of people movement, we were protected physically by the state, and people were not moving around. And as that has eased down, people more free, returning to work, returning to normality, that obviously created a foundation, a fertile ground, for lack of a better word, for the virus to find hosts to transmit to. And that is what we are observing. Unlike the first part of the epidemic, we noticed that in the earlier peak of the epidemic, we tended to have older people being infected and mostly succumbing to the virus. That is still the case, and people have comorbidities. But what has been noticed and is a very active discussion in the media throughout the world and in South Africa is that this current wave or this resurgent pattern seems to be linked to younger people, and there is a discussion on young people driving this second wave. This is obviously not meant to throw any aspersions to any members of who are listening, but just to have a frank discussion on how can we play our part, particularly as a university community with a high number of people who are in the younger age group, to see how they can play their part in controlling the spread of the epidemic. We have seen how epidemics have, the outbreaks have been reported in other universities outside ours, and Dr. Lascelles will speak at length to that epidemic outbreak that has been observed in other universities and specifically in our university recently. but it is something we need to discuss on what are these drivers of resurgence and how can we play our part in ensuring that we do not suffer the same fate that has been reported in other parts of the world, specifically in Europe. Okay, and next I will just touch on what has been findings in the research community as far as a vaccine development goes. Obviously, we all are waiting with bated breath that a vaccine is found, with the hope that once a vaccine is found and readily available, which is another big hurdle that we need to cross, that we will be more free to return to normality. Currently, 4 vaccines have reported their results and have shown relatively good efficacy. The one vaccine, which is the Pfizer vaccine, which reported a high efficacy of 95%, similar to the Moderna vaccine. These are similar type of vaccines, have reported fairly high efficacy in the studies that have been conducted. And I think as recently as today, Pfizer was actually granted registration in the United Kingdom. Another success story has been the Russian vaccine called the Sputnik vaccine, which has also reported a high efficacy rate, although there has been some skepticism from researchers across the world because of the smaller numbers that were involved and the extrapolation that can be taken from those findings. Another success story, which also was an early horse to show success, was the Oxford vaccine. And this particular vaccine had different efficacies at different dosing regimens, ranging from 70% to 90% in one of their dosing regimens. So there is hope that a vaccine will soon be available, but the challenge is there can be so many doses. Not everybody will have access to the vaccine. There are obviously huge costs to it, and we need to be mindful that even if it is readily available, we know what happened with testing kits earlier on in the year, in that even when there is the will to buy all these commodities, there is such a huge demand and there's not enough to go around because the whole world is waiting on the same resources. So that becomes a challenge. So what are the take-home messages from knowing that the virus is still there, it's still causing a pandemic worldwide? Is that we need to not forget that we are still in the grip of a devastating pandemic. It is still with us, it has not left. In South Africa, sadly, we are now in the middle of a resurgence that we are observing in 2 of our coastal provinces. And because of this, there's a risk of spreading to other parts of the country and to other provinces. And this is especially a high risk as we are approaching our festive season and people are traveling back to their loved ones and with that, moving the virus along. But there is hope in that the epidemic control is still achievable, because even in the absence of a vaccine, we have, science has shown, a lot of studies have reported that non-pharmaceutical interventions work and they work well. And we still can use these to control the epidemic. And we cannot afford to let our guard down and continue to spread the epidemic. So in closing, I'll just share what the government of South Africa is telling us to use and recommending is always to keep wearing a mask, especially when we're in public. And masks have been shown to not only protect the wearer, but to also protect the other people. There is also evidence that masks also prevent asymptomatic transmission. So a person cannot say, because I do not feel sick, I should not wear a mask. With wearing a mask, you also preventing transmission even when you do not know that you are a carrier of the virus. We need to continue maintaining physical distance because the virus spreads by droplets. And if you're standing at least 1.5 meters away from the next person, that limits the chance of a droplet spreading from one person to the other. And also to continue to wash our hands and sanitize regularly so that we do not carry the viruses in our hands. And I would like to acknowledge the resources that are accessed for this presentation, which is the NICD surveillance report and testing summary, as well as the KwaZulu-Natal Department of Health situation report, which is published daily by our Department of Health. A very good resource is the South African coronavirus website, and it carries a lot of good video clips and important points and resources on how to prevent infection of COVID-19. And lastly, Dr. Richard Lessels, who was kind enough to share some of the slides that I've shared with you this afternoon. So thank you very much.
Thank you so much, Dr. Msomi. Even though you don't hear it, we are giving you a round of applause. We really appreciate what you have shared with us. Because we are going to take the questions and the discussions later on, I'm just going to invite our attendees to share questions in the Q&A if you've got any question. And there is no question that is dumb enough, please ask. And I also just want to reiterate the point that Dr. Msomi made, that the point about who are the people driving the infections is not an aspersion on students. It's just the reality that we are facing, and we need to talk openly about it. Please don't take any offense. I think that we can all equally contribute to the spread, but we are trying our best to try and understand how to limit the spread. I'm going to then invite Dr. Richard Lessels to share his presentation. And Richard is also an original member of the UKZN War Room, and he is an infectious disease specialist, and is also with the University of KwaZulu-Natal through the KwaZulu-Natal Research, Innovation and Sequencing Platform Center, CRISP, in the School of Laboratory Medicine. So Richard, you are welcome, and thank you for taking the time. We know that you are on holiday and you should be resting, but you have agreed to basically share the details of our experiences at UKZN with COVID-19. Please take it ahead. Thank you.
Thanks very much, Mosa, and thanks for asking me to be part of this. And I think it's just another example of how the university has really stepped up and shown a lot of leadership on trying to do our best to prevent the spread of this virus on campus, off campus, and seeing our responsibility not just as a university community, but to the wider community in the province and in the country. And it's a great honor to be part of that. I want to just very briefly just kind of go past what Dr. Msomi said and just give a little bit of background, because it provides the context to thinking about clusters and outbreaks of infection in the university setting. Because there's still a lot we don't understand about this virus, but over the kind of 11, 12 months now that we've been dealing with this virus, we've learned an awful lot. And so there is a lot that we do know. And really the key thing that we know is that this virus spreads very easily and very quickly wherever people are in close proximity to each other. And that's why universities and university residencies become important places to think about the challenges of preventing the spread of the virus, because there's a lot of people in close proximity. And so it's one of the most challenging environments to really prevent the spread. And that's why we have to understand it, and we all have to play our part in trying to not become part of a chain of transmission, or if we do become part of a chain of transmission, to make sure that it stops at us and doesn't carry on spreading from us. So I want to just briefly give you the basic understanding of how this virus spreads. And the basic principles here are this virus spreads through the air. So it spreads in what we call droplets and aerosols. And these are basically particles of water, essentially, or moisture that come out of our mouths when we talk, when we cough, when we sing, when we shout. And some of them drop to the ground quite quickly, the larger ones, and some of the smaller ones can stay in the air for a little bit of time. And if I'm in close proximity to the person who's emitting these particles, then I can either breathe them in, or they can land on my mouth or my nose or my eyes and get into my body that way. The other way that it can spread is through contact, and that essentially means when we touch surfaces where these droplets have landed. And that can be any surface. It can be a door handle, it could be a table, it could be a kitchen top. It can be anywhere where these droplets can land. And so if we understand how this virus spreads, this really underlies the principles of prevention and how we can prevent the spread of this virus, both whether we are the person that might be infected and might be emitting these particles, or we might be the person that's susceptible and is walking around, and we want to avoid ourselves breathing in any of these particles that might be in the air around us. And so when we think of the prevention measures that Dr. Msomi just mentioned, you can think about them all from this diagram. The physical distancing is clear, that the further away we are from other people, the less risk we have of breathing in or of these larger droplets landing on us. And remember, there's nothing magical about 1 meter or 1.5 meters or 2 meters. The basic principle is the further away you are from people, the better, and the lower risk you're at. It also underlies why mask wearing is so important, because mask wearing is about trying to prevent these particles being emitted from somebody who may be infectious. They may also, to some extent, protect this person from breathing in or from the bigger particles landing on them, but they are primarily to try and prevent these particles coming out from somebody who may be infectious. And then you also know about the hand washing, and that's important for the contact spread. And then one of the things that doesn't get mentioned enough, but probably should be, is the importance of ventilation, the importance of just good natural ventilation, opening the windows wherever you are. And that certainly shouldn't be a problem at this time of year. It's clearly a bigger problem in the winter, but at this time of year, we should all have our windows open wherever we're in close contact with other people. So that just gives you a basic understanding about the spread of the virus. The other thing that's made this virus particularly challenging for us to control is the fact that people can be infectious before they develop any symptoms. So before they know that they have the infection, they can be infectious to other people. And this graph just highlights that. It's just showing from when somebody's exposed to the virus, how the level of the virus in their body goes up quite quickly, and then comes down again within a week or 2 weeks or so. But we know that in the 2 or 3 days before somebody gets sick, they have enough virus in their body that they can be infectious to other people. And again, that makes this virus very difficult because it means we can't rely on symptoms to tell us who's infectious around about us. And that's again why it's so important that we all take these prevention measures, why we all wear the masks, because unfortunately, we just can't be sure on any given day that we don't have the virus in our body and are infectious. We just don't know because we can't rely on being sick. Now, the other thing that's important is just to understand how the virus spreads through the population. And Dr. Msomi touched on this. She mentioned this basic reproduction number, which some of you may have heard about. We talk about it a lot. And essentially what that number is telling you, on average, how many people will one infected person transmit the infection to. So what we know is this number, if we don't do anything at all to try and prevent the spread of this virus, this number probably sits somewhere between 2 to 3. So let's just, for this example, say that it's 3. So what we're saying is, on average, each person will infect 3 people. And that's how the virus spreads through the population exponentially. You can just see this will continue to spread. And it spreads very quickly. The time between each of these layers is only a few days, maybe 4 to 5 days or so. But actually, again, what Dr. Msomi highlighted was it's not as simple as this. And what we see, and what we've seen a lot in South Africa, and what we're seeing again now, as there's less transmission generally in the community, what we see is that this virus spreads by clusters. Now, what we mean by that is that actually probably most people with the infection don't actually spread it to any other people. So if you see the diagram here, these 2 people here actually don't spread the infection. So the spread stops at them. But this person here, this third person, actually transmits to 9 people. So hopefully what you can see is the effect is still the same. The average is still that each person is spreading to 3 people, but it's not averaged out. What it is that this one person is spreading to 9 people. And this is what we might call a cluster, or we might call an outbreak. And the other term that you've heard is this term super spreading events. So something has happened here to allow this person's virus to infect 9 other people. And we know well now from lots of places around the world, including South Africa, that this is how the virus likes to spread. And when there's relatively low levels in the community, this is what you're going to see. And that's something that Dr. Msomi highlighted, that what we think has partly kind of kick-started resurgence in the Eastern Cape and the Western Cape was these clusters of infection that were centered around educational establishments, universities in the Eastern Cape, around social settings, kind of bars and nightclubs in the Western Cape, and potentially in the Eastern Cape as well. So I'm going to come back to this slide. One of the key things that, one of the key prevention measures is trying to understand where these events happen, where many people get infected all together. And a simple way to think about it is that these things happen where one or more of these C's are happening. So the 3 C's are crowded places where there's many people close by, close contact settings, so where people are going to be not able to physically distance, where people are having close range conversations, and worse than just conversations is if people are shouting or singing in close range. And it's places that are confined and enclosed where there's not good ventilation. And the highest risk places are where all three of these C's collide. So where you've got crowded, close contact, confined spaces. And unfortunately, coming back to what I said at the start, this is the real challenge of universities and university residencies in particular. Because it's a while since I was living in university residence, but having seen some of the residences, it's clear that residencies are crowded places. There's lots of you packed into a residence. You can be in close contact with others when you're there. There's shared common areas, of course. And some of these residences can have challenges with poor ventilation, and so you can be in confined and enclosed spaces. So what this means is, because of these challenges, we have to think extra hard about what we can all do to prevent the spread in these settings. So just to give you a little bit of understanding as to what's happening or what's happened at the university recently, and Norma mentioned this at the start, what we've seen over the last 6 weeks or so is we've detected around 50 cases of COVID in students living in residences. And those 50 cases are spread out over around 11 different residences. And what I'm showing you here is just something that's called the epidemiological curve. It's just simply a way that we track what's happening over time. And you can see this for the whole country, or Dr. Msomi showed you some of the ones for the different provinces. Here we're just showing the same thing, but for the university residences. And I don't need you to see the detail here, but what this is showing is just every different color is a different residence, and each block is a case. And so what you see here is you see these clusters in real life. So you see, here's a cluster of cases at this residence that's colored in green. Here's a cluster of cases in the residence in pink. Later on, here's a cluster of cases in the residence that's colored gray. So what we've seen over the past few weeks is these clusters happening in a few different residences. And this is kind of just summarizing. We've picked up that at 5 different residences, there's been these clusters of cases. So the biggest one, there were 20 cases in a single residence, and then similarly 13 cases in another residence, and then 3 residences where there were some kind of smaller clusters of infection. And when we looked into these with Jabu, who's going to speak to you, and the other nurses and the team on the ground, we could understand a little bit about how the virus was spreading in the residences. And we could also understand that there may well have been some links between some of these residences. And so what we picked up was that there were events happening on and off campus where people from different residences were still coming together, and where some of the prevention measures were possibly not followed as strictly as at other times, and where there was certainly the potential for the virus to spread amongst a large group of people. And so this was one of the ways how the virus might have found its way to spread between the different residences. And coming back to the point made at the beginning, one of our big worries in the next few weeks is trying to prevent these clusters from growing, try and prevent new clusters happening, because what we really don't want is for people to get infected in the next few weeks and then to travel home with the virus. One of the characteristics of these clusters in the residences is that the vast majority of people that got the infection were not made very sick by it. They had mild symptoms, and that's typical for students who are young and generally healthy. And but the concern, as Prof. Moshabela highlighted, was the importance of trying to prevent spreading to people that are more vulnerable. And that means your parents, your grandparents, your uncles, aunts at home, who may be older and therefore at higher risk of getting sick, or may have comorbidities, other things that put them at high risk of getting very sick or of dying from this infection. So again, just highlighting what Dr. Msomi mentioned, the key prevention measures are really the simple things. And all that we have to do is, when we think about the university and the residencies, we just have to pay extra attention to trying to do these things as best we can at all times, and not letting our guard down. I think that's the title of today's webinar, and it's really very important. It's about not letting our guard down at any point when we think that we may not need to do these things. Actually, we need to do them as often as we can, and particularly in the settings where the virus is most likely to spread. So it's the physical distancing, it's the mask wearing, it's the regular hand washing, it's keeping windows and doors open to allow good natural ventilation. And then it's about getting help quickly from Jabu, one of the other nurses, if you become symptomatic. Don't sit and wait and just see how the symptoms develop over a few days. Get help immediately and get tested, so that if you do have the virus, we can help you and we can prevent it spreading to other people. And then the importance of self-isolating, separating yourself from other people if you do develop symptoms, or if you find that you've been exposed to somebody who has the infection. Then just the very immediate measures you can do to separate and isolate yourself from other people while you get help and while you get tested to find out if you've got the infection. So I'm going to finish there just with that diagram, just to show you that it's really these basic measures that remain the key components of what we can do to prevent the spread in the university, in residences, and once you go home to homes over the Christmas period and over the holidays. So I will finish there and hand back to the Prof.
Thank you so much, Dr. Lessels. Really, really appreciate your input and the summary that you have provided. And in 2 slides, you don't really capture the true nature of the investigations that went into the outbreak investigation, the amount of work that went into the outbreak investigation. And there's a whole lot more detail that could be shared, but I think that you have made the key points clear, the key messages clear. And I think that this, in a way, I think that at some point the university does need to see how much work goes into this. But maybe perhaps it's best to start by showing the details of the interventions that have been put in place by Campus Health. And before Jabu speaks, I also want to just make sure that it is clear that there is a whole lot of people who are involved in all of this work that we are presenting. Jabu, Ms. Klope is going to speak. She is an occupational nurse on campus. Our campus health has people who are clinical nurses, but we also have occupational nurses, and they work together as part of the campus health team. They are really the ones who are driving the interventions that we are implementing, the prevention work that we are doing, the testing, the contact tracing, a whole lot of work that goes into managing the interventions on the ground. And Jabu is also one of the people that joined our war room, and she has continued to work as part of the larger campus health team, which is chaired by our head of and DVC of the College of Health Sciences, Professor Ngama, working with the doctors in the campus clinics who are doing occupational health, Gobadin, as well as people who are helping to manage the process. There's also other occupational health nurses who are involved in this work, and clinical people. But I'm going to hand to Jabu to share with us and the attendees what goes into trying to implement these interventions on the ground in order to prevent the outbreak. Go ahead, Jabu. Thank you so much.
Thank you, Prof.
If you can share your slides again, it would be wonderful. Thank you. They were there, but they disappeared. Just share them again.
Right. Thank you, Prof, for providing me with this opportunity. I would like to greet our colleagues and our students this afternoon. Dr. Richard.
Sorry, Jabu, I still don't see the slides. I don't know if it's me.
You don't?
Yeah, so just try again. They were there before. So just go back to share screen and then put up the slides. Is the technical, oh, there you go. Yeah, that's it. Just put we can see emails, but put choose the slides first. If you stop share and then start again and share screen and then choose the slides. Just close the emails, stop share, and then share screen again, and then choose the PowerPoint slides. And they should appear again. There you go. That's it. Yeah. Thank you.
Good afternoon again, colleagues. As Prof. Mushabela has indicated, I'm Sister Jabu Hlope. I'm one of the occupational health nurses for the UKZN. I am going to take you through all the safety measures and the systems that the university has put in place to prevent the spread of COVID-19 in our campuses, and also to prevent the further outbreaks in our campuses. Dr. Richards has painted a clear picture of what is happening in our residence and in some of our campuses. To begin with my presentation today, I do want to mention that in the UKZN, we have 5 campus health clinics around our university. We have Howard College, Medical School, Westville, Pietermaritzburg, and Edgewood. We have a toll-free number where if you have any queries related to COVID-19, that you can dial, and this toll-free number is going to take you to either of these campuses, depending on which campus you need assistance from. Also, in each and every campus, we have the UKZN Campus Health Team, which is responsible for ensuring that our students and staff are safe and healthy while they are in our institution. We have 3 different sections in our campus health teams. There is PHC, who reports to the ED of the Student Support Services. They are responsible for management of the students. And then we have occupational health, who reports to the Director of RMS. They are responsible for the staff, and also as Prof. Mashabela has indicated previously, the OC health nurses were also delegated to manage the COVID-19 of all our staff and students in our campuses. And then we have our HIV and AIDS program, which also reports to the ED of Student Support Services, who deals with the HIV services. They also assist us with the contact tracing and also the health promotion and the behavioral changes. And then across all our campuses, we have 4 occupational health nurses who are there to assist each and every one of us who are having any queries regarding COVID-19. In Howard College, we have Sister Jane Taylor. Her contact details are reflecting here on the screen. And in medical school, we have Sister Nozipo Jali. Also, her contact details are reflecting on the screen. And for Westville and Edgewood campus, there is Sister Jawa, myself. My contact details are also here on the slide. And for PMB, we have Sister Kukum Dunge. Her contact details as well are appearing here on the slide. In UKZN, when the whole COVID-19 started, UKZN developed a multi-pronged approach to fight the spread of COVID-19 in our campuses. We have a COVID-19 war room, as our Prof. Mushabela indicated previously. This war room was launched in March 2020. We also have our multidisciplinary team, which consists of our public health specialists, our occupational health nurses, and our infection control diseases and diseases specialists. Also, a task team a COVID-19 task team was developed by our Professor Prof. Ngama, which was also responsible for developing the framework of reopening UKZN post lockdown. That was in April, May 2020. And also we have our COVID-19 advisory committee. All these teams work together in ensuring that we have appropriate SOPs in place, SOPs like the self-screening SOPs, the on-site testing SOPs. They're also responsible for all the protocols that you see that are in place, protocols like dealing with the outbreaks and reporting to the NICD and using the NMC app to report our cases. And these teams, they assisted us a lot in ensuring that we have a good relationship with the KZN Department of Health and the eThekwini CDC and our national health laboratories. Right, I will begin with our first measure that we have in place to prevent the spread of the COVID-19 in our campuses. We have a UKZN self-screening app, which is accessible in this web that is appearing here on the screen. This screening app is very easy to use, and it takes only about 20 seconds to use. If you go to our screening app, you will see there are different questions there, which are key symptoms of COVID-19 and other general symptoms which may be related to COVID-19. So if you screen yourself there in the screening app, as each and everybody who's entering our campuses, whether you're staff or you're student or you're a visitor, you are required to screen yourself in this screening app. So if you screen yourself in the screening app and you don't have any of the symptoms that are listed there, you will, at the end of your screening, get a green result, which indicates that you are a low risk and your access will be allowed to the university, but with the wearing of a mask. And if maybe you have one of the general symptoms which might be related to COVID-19, at the end of your screening, you'll screen orange, which means you are a medium risk. And then immediately the securities at our entrances will refer you to our campus health clinic where you'll be assessed. And if there is any need for you to be tested, they will assist you further. And if you have one of the COVID-19 key symptoms, then you will screen red at the end of your screening. This indicates that you are at risk. You might be having COVID-19, so your access to the university will be denied. The securities, they will assist you further and refer you further. So let me talk a bit about this, when you screen red. What happens there, the occupational health nurses are able to have a look at the back of the screening app, and they follow up at all the people who screen red. They phone them, and if there is an indication for those people to be tested, they will refer them accordingly or advise them on how they're going to test on site. Right. I would also like to take you through the slides, which is showing us who is the COVID-19 suspect. If you are having acute respiratory tract infections like cough or sore throat, as I have indicated before, if maybe in one of those questions in the screening app, you tick either maybe cough or sore throat, which means you're having one of the lower respiratory tract infection, that makes you a COVID-19 suspect. Or maybe you have other clinical illnesses compatible with COVID-19, like our general symptoms, diarrhea, and weaknesses. Also, if you have those symptoms, you are a COVID-19 suspect. And also, even if you don't have any symptoms, but you had a contact with a positive case, then you are also a COVID-19 suspect. So in UKZN, we have our on-site testing lab, which is based in Howard College, managed by Prof. Anil and the team. And in that lab, they do the saliva PCR molecular testing. And I do want to indicate, colleagues and students, that saliva is the watery colorless substance produced in your mouth. It's different from the sputum. So with these tests, we do the saliva testing, not the sputum. So what is going to happen if you are one of the suspects? Maybe you screen red and the occupational health nurses advise you to do the testing or decide to test you on site. You'll be issued with a specimen container where you will need to label it with your full names, your surname, your student number, or your staff number using a pen. And then the next morning, before you eat or drink anything, you'll be required to put your sputum, your saliva, not sputum, your saliva in the specimen bottle. We always advise people to put enough saliva for the lab to be able to do the test, maybe 1 to 2 mils of saliva. And then after that, when you've put your saliva, you seal the specimen container with the lid and place it in the plastic bag that will be provided to you. And then you put it at a designated collection point where our drivers goes around the campuses and collect our specimen for us and take them to the lab. And then in UKZN, we are lucky because our results doesn't take long like other places. Usually our result takes about 24 to 48 hours, and they are sent to the occupational health nurses of that respective campus. but we always advise people. I think Dr. Richard did mention that if you have tested for COVID-19 and you are waiting for your results, we advise people to please self-quarantine. I will also go through the self-quarantine measures. So what do we mean by self-quarantine? Because we have had cases where people don't understand exactly what we mean by self-quarantine. Quarantine is for people who are asymptomatic, but who may be infected with COVID-19, which means these people doesn't have symptoms, but they may be infected with COVID-19. So this self-quarantine help us to keep these people away from others so that they do not infect other people unknowingly. One of our panelists did indicate that some of the people do not show any symptoms. So if we self-quarantine people, we're trying to avoid any spread of infection, especially from people who doesn't know that they are infected. So if we ask you to self-quarantine, we expect you to stay in your room, use your own bathroom if possible, and with no visitors in your room. You don't travel around, and we expect you not to have unnecessary contact with other people. And while we are on self-quarantine, you need to know who to call or where to go if you develop any worsening symptoms so that they'll be able to assist you further. And also you avoid sharing household items like dishes, cups, eating utensils, towels, etc. But if you use any of those in your household, make sure that you wash them properly with soap and hot water. And if you want to do your laundry during your self-quarantine, make sure that you wash all your laundry at the highest temperature, preferably above 60 degrees Celsius. And also you carry on, you continue with the behavioral changes. You continue with your hand hygiene. You clean your hands with soap and water frequently for at least 20 to 40 seconds. You sanitize, as Dr. Msomi indicated in one of his slides. You wear your mask and you maintain your social distance, and you stay in your room with your doors closed, only going out if it's necessary. But if you stay with your doors closed, we mean you don't go out of your room, but you do maintain ventilation, as Dr. Russell mentioned in one of his slides. And also you practice your cough and hand etiquette. You don't do any handshakes. You cough and sneeze into a bent elbow. If you use a tissue to cough, you discard it immediately and wash your hands. And you clean all the high touch surfaces appropriately as well. So now what happens if we test you and then your results come back positive? If you are COVID-19 positive, you'll be expected to isolate. Isolation is for those people who are already sick or who have tested positive for COVID-19. This may include self-isolating at home if you are able to meet the required criteria for isolating at home. But if you stay in our residences, and unfortunately you cannot isolate in the residences because as I think Dr. Richard indicated that most of our residences are crowded. There's a lot of students in the residences. So it is impossible for somebody to isolate in our residences. So what we do in such cases, we transfer you to our KZN Department of Health Isolation Facility, which is a Clare hospital. So everybody who tests positive and they stay in the residence, they cannot isolate. We move them to the isolation area, which is Clare Hospital. And remember, the reason why you need to isolate, COVID-19 is a notifiable medical condition. For us to limit the spread of the virus, we need to send you to an isolation area. And also for you to get appropriate medical care. And while you're isolating, we always advise our students and staff to carry on with practicing these behavioral changes, the wearing of surgical mask, the respiratory and hand hygiene, and also physical distancing. And then what we do now, if a case has been identified, we look at your contacts. Contacts are people that had a face-to-face contact with you, which is less than a meter, or people that were in a closed space with a COVID-19 confirmed case for at least 15 minutes. So these people will include your all persons living in the same household as you, if it is positive, and people working closely with in the same environment with you as well. It will also include healthcare workers and other people providing direct care for a COVID-19 person while not wearing a recommended PPE. It also include a contact in an aircraft, sitting within 2 seats in any direction of the confirmed case. So what we do, we have the measure that we have in place in the UKZN. We do contact tracing every time a positive case has been identified. Our HIV and AIDS and disability program assist us with the contact tracing to identify all the contacts of the case and manage them further. And then that is oversighted by the occupational health nurse practitioner following the KZN Department of Health guidelines and the eThekwini CDC guidelines as well. And then all the contacts, and then all close contacts tested for COVID-19 as soon as possible after the exposure to the confirmed case. And immediately we'd advise you to quarantine, as I've indicated before. When you have done your test, you quarantine while you're waiting for the results. You don't come on duty while you're waiting for your results. We have had cases where people still come on duty while they're waiting for your results. You quarantine when you are waiting for your results. I've indicated in the previous slide what we mean by quarantine. The main aim of advising you to quarantine is to prevent the further spread of the virus. Now, if these close contacts, maybe their tests come back positive, they will also be isolated, as I indicated in the previous slides. If you stay in the residence, you'll be referred to the Clarewood Hospital. If you are able to isolate at home and you stay at home, you'll be advised to do so, but following the correct criteria of isolation. If you test negative, you will be advised to remain in self-quarantine for at least 14 days, and then you monitor your symptoms during that period. And when the 14 days is over and you as a contact who doesn't have any symptoms, then the retesting is not required, and then your quarantine will be discontinued as well. Now, we also have other concurrent measures in place in the university to fight the spread of the COVID-19. What happens as soon as a positive case has been identified in a certain department or residence, an appropriate decontamination processes is followed using our South African COVID-19 infection prevention control guidelines. Remember, I indicated in one of my first slides that our teams assisted us in developing the SOP and the protocols. All our SOPs and our protocols are in line with the Department of Health and NICD guidelines. And also we have extensive primary prevention measures that we do. All our UKZN protocols and policies are constantly re-evaluated and revised pending the current scientific evidence or the protocols and guidelines from the relevant authorities like KZN Department of Health and NICD and HLS, as I indicated before. And also, one of the measures that I've mentioned All staff and students and visitors entering our campuses are screened using our self-screening app, and they are managed further depending on their screening results. And also the university has increased the availability of the cleaning and disinfection processes in the university, to such an extent that all our cleaning staff have been retrained on a proper cleaning and disinfecting procedures as well. And we always encourage as well the use of appropriate PPE by relevant people. And remember, in UKZN, we have the universal cloth mask policy. It was indicated previously by some of our speakers. Everybody who enters in our university is expected to wear a mask. If you walk around our campus, you are expected to wear a mask. You're sitting in the quad with your friend, you are expected to wear a mask. And also our health promoters are going around reinforcing all our safety measures and health education and creating awareness in our students and staff. And now, colleagues and students, we know it's December time, the festive is here, and we all have planned activities for our families and our relatives. I would like us to think about the 4 key dimensions of COVID-19 risk every time when we plan these activities for December. I think Dr. Richard has indicated, has spoken about some of this. The first key dimension that I want us to look at is the people. When you are planning an activity for December, you must also always know who will be in your activity. And you need to prioritize people who are in your household as well. And avoid strangers in your house. And keep the total number of people as low as possible in your household. And also you must consider the space. Where will the events be? You stay outdoors as much as possible. And if you must be indoors, choose an area with good ventilation. This was indicated by one of our speakers. With ventilation is very important. You choose an area with opening doors and windows. And also you must consider the time. How much time are you spending with these people? You need to reduce the risk by shortening the amount of time you spend with other people, especially if you are indoors. And the last dimension that I want us to look at is the space. How much personal space is available, and can you distance in that space? At minimum, people should be staying 2 meters apart. But when singing, as indicated by Dr. Richards, when singing, laughing, talking loudly, 2 meters might be too close. So in those cases, more distance is safer. And always wear your mask, and your mask must be worn properly over your mouth and your nose. And colleagues and students, you must always remember, you must always wear a mask. Wearing a mask is a way of showing that I protect you and you protect me. Always wash your hands with soap and water, sanitize with at least 70% alcohol-based sanitizers. Always watch your distance from others, especially if you are not in your household. Avoid crowded places. Dr. Richard has spoken on this as well. Avoid crowded places and avoid close contact with other people. And also avoid closed spaces, like to be indoors. If you are indoors, make sure you have enough ventilation in that space. And in closing, colleagues, I would like to acknowledge the following people who have worked very hard to ensure that our university and students' health and safety is maintained during this COVID-19 situation. I would like to acknowledge our UKZN Executive Management, our Prof. Busngame, the DVC of College of Health Sciences, and the COVID-19 Outbreak Advisory Team. I'd also like to acknowledge our UKZN COVID-19 War Room and the task team. And I would also like to acknowledge my colleagues, the occupational health nurses, and I would also like to acknowledge our occupational health medicine consultant, our Dr. Rakesh Gordin, and also our campus health PHC team, who are always on our back, supporting us all the time, in our HIV and AIDS program, and our health promoters, who always assist us with contact tracing and health promotion as well. And I would also like to acknowledge Prof. Anil and the team. They've done a very good job. They've worked very hard to ensure that we get all our results within 24 to 48 hours, which doesn't happen in other places. And I also like to acknowledge our UKZN ICS for developing our screening app, which we are using to screen our staff, students and visitors. And also I would like to acknowledge lastly, our UKZN RMS, who have worked very hard to ensure that everybody who enters our premises are screened at the entrances. With that, colleagues, thank you so much and have a lovely evening. Thank you.
Thank you so much, Sister Jabu, and that was absolutely amazing. And I really hope that this presentation can be made available. We are live on YouTube. I hope that the YouTube recording will be made available if at all possible. It'll be great if every student and staff member in the university can be able to view this. So thank you for that. I would like to change tune. We've given you an information overload, and I understand that we are coming towards the end of our time, but we will not do this justice if we do not give our respondents an opportunity to make comments. I know that our president is going to go first, but maybe I'd like to shift things around and start with Dr. Majola Xolisa to give us comments. Dr. Majola is a lecturer in the Graduate School of Business and Leadership here at the university, and she's basically going to share her experiences with us. She'll tell us who she is, and if Doc, you can keep it down to like 5 minutes, it would be great. And I wish we had more time with you because I would have really liked to engage more with you, but please open your video, take a moment to share with us. And if there's anything that you want to highlight from the presentations, you're most welcome to do that. I'm gonna switch off my video and give you a moment to speak to our audience. Thank you.
Thank you so much, Program Director. Thank you so much for the invitation. All protocols observed. To share my experience with COVID-19, I remember that I got it was the 1st of August this year. And then I was very worried when the outbreak came out because I knew that I'm one of the people that are very weak. I've got a weak immune system. So I was very worried about that, and also had an underlying condition. I had some lung issues that I was still going through investigations. And then when that happened, I started when everyone was talking about what to do and what not. I was very careful with everything that I was doing. And then while that was happening, I got dizzy on one of the days, and then I was not going out a lot. In fact, I was just at home most of the time, and we were still working from home during that time. So when I got dizzy, and then I got worried because my helper was also dizzy. She was not feeling well, and she was like above the age of 60. So then when that happened, I then went to see the doctor. And then when I went to see the doctor, I was feeling fine. Everything was just fine. And I was like, I'm just worried, not that I'm sick already, but then I'm just worried because I know that I'm very weak. And then I went and did the test. And then they told me that they are going to come out after 3 working days. And it was going to be the weekend from Saturday, Sunday. Then I was expecting the result to come back on Tuesday. And then when I got home, then I realized that I didn't have enough food. Then I went shopping the following day. While I was busy doing the groceries early in the morning, and then an SMS came in, tested positive. My worry was the people around me during that time, because I was like, I had tried to make sure that I stay out of everyone. But unfortunately, since I stay alone, I couldn't stay inside. So I had to go and get food. So then when I got that, got my results, and I started doing quarantine. And then after 14 days, I came out. I think the challenge that I had was when I got my results and then the doctor gave me the prescription, I couldn't find medication in quite a number of pharmacies because they were out of stock. So that was my first issue that I had. And then as for the symptoms, I never had any symptoms that were like the ones that people talk about, having shortness of breath and all of that. I never had that. But nevertheless, I had it because I do remember the days, like the first 3 days were the ones that were difficult because I was having fever. I was feeling very cold and then very warm at some point. And then had the issues when they say that it deals with your underlying conditions. Since I wear glasses, I've got an issue with my eyes. So my eyes were very painful. And at some point I was like, maybe they're coming out. So I had that issue with my eyes, but then nothing much. And also what I think I wanted to emphasize on is that people will tell you about the different symptoms that they will have and whatnot. I didn't have that. And then the issue of muscle pains, yes, I had the muscle pains, and then I was not coughing or anything, but I had the muscle pains. And then after COVID, I had to make sure that I sanitize my house again so that everything is clean and then back to normal. So with my helper, she went home and did isolation as well. And luckily for her, she never had anything. So she went for testing and then her results were out. And that is what I wanted also to highlight, that she is above the age of 60 and yet I'm very below 60, but yet I had it and she didn't have it. So that is one thing that I wanted to highlight. And also the issue of wearing a mask. For people who wear glasses, it's very difficult, but then it's doable. You get used to it, and then you need to do it. You don't have to hide about, like, it causes mist in my eyes and whatnot. So you can still wear it. We do wear them like that. And I think lastly, the issue of, the testing things that they use to screen when they are screening us. I remember that since I'm saying that I went to do shopping, they did that and then it came out clean. So people should not be fooled by saying that, no, I always test when I go for screening. My results are always 32 point something, 33 on whatnot. You can get those numbers, but yet you are still positive. So I think that is what I wanted to share briefly. I hope I covered everything. Thank you.
Thank you so much. I really wish that we could have a more detailed discussion. And in fact, I am going to ask Ms. Nomazondo to help us do a little bit more of this, because really the message today, you're bringing out the issues that I think that we want to highlight. We forget when we are preparing slides and all of that, we forget about the mist in the glasses. We experience it when we wear masks and we figure out ways to overcome it. But then actually, when we are talking to people, we forget that these are the practical things that people face and they need to find ways to actually overcome them. But thank you so much for sharing, Dr. Majola. We really appreciate it. And please stay online in case there are questions that you will be able to answer. But once again, thank you for taking the time.
Thank you.
Yeah. So now I would like to invite Mr. Mngobi Msizani, who is a student, and also he's also going to share his experience with us. I know that Mr. Msizani, you are busy and there are things that you're working on, but we appreciate you taking a moment to join us. Please, you can go ahead and unmute and share for a few minutes what you have to share. Thank you.
No, thanks, Prof. Perhaps I must first greet the President of the SRC, the first student of UKZN, and all the honorable professors and doctors that are present, including yourself, leadership, where we met during very harsh times when we had to take unpopular decisions.
I know.
It was very tense.
And you said to me that the one thing you don't want is COVID-19.
Yeah, hey, you see, but unfortunately, COVID-19 caught up with me.
Yeah.
Well, I'll be very brief. Of course, I hear that there is an issue of time now. I was confronted by COVID-19. Unfortunately, I think it was towards the end of June, 29 June to be exact.
Yeah.
When it was an overwhelming experience, really. But what I would want to say first is that we are told that there is flu-like symptoms.
Yeah.
But when I got COVID, it was clear that those were not flu symptoms at all. You can just tell they are very extreme. And my COVID, really, I don't know what happened, but it was too extreme. I remember I would cough non-stop for more than 2 minutes, and I couldn't breathe in between. The experience is just, I don't know, out of this world. And I think if I had to get COVID-19 again, I think I would be ready for it now. Well, I think I was lucky enough that our COVID-19 team in place in KwaZulu-Natal is very effective. I remember I would even chat with Sister Jabu. She would call me on a daily basis, and she really took me through the process, and I uploaded her for that, and we even talked after that harsh experience. Yeah. But I think what is important is that we know that COVID-19 is real, and I see most cases people tend to think that no, since they've never got it, or someone thinks that if you haven't got it yet, it's a myth or something. And people are looking at all these stats that we're getting each and every day and thinking, no, you see, if you're not affected by it, you just think that, no, they're making it up or something. So I just want to attest that COVID-19 is real, and fortunately, we haven't been told of any student that has died of COVID-19 as yet in KwaZulu-Natal. Of course, because of our system, that is very strict. There is the measurements that are in place there to respond adequately and swiftly whenever there is a case of COVID-19. I remember there was a report where there was an outbreak in one of our residences, and our team was very, very sharp in addressing that. And yeah, the only reports that we get are rather positive than hearing of a deceased student from COVID-19. So I think it is very imperative that people look out for it. People always, at all material times, follow the protocols and follow the measures that are in place to assist students and staff members. I think I'll end there for now. Thanks.
Thank you so much, Mr. Msizan. We really appreciate it. Thank you for your time. I'm now going to invite the president, Mr. Sebonga Moses Nkamango, to speak to us. He's also a student in biokinetics department, and also the president of the SRC. So we have asked him to respond to all these discussions and share his thoughts with us. Please go ahead.
Thank you very much, program director, how should I say, facilitator of the program.
Yes.
One must begin by passing his humble yet revolutionary salutations to the members of the council that are present here, to the executive management committee led by Prof. Nanapoko, the convocation led by Mr. Fanley, SBC as president, the student leadership known as the SRC, which is led by myself, to the corporate relations department led by Ms. Noma Zondo, to all the stakeholders that are involved in the formulation of this webinar, and most importantly, to the larger stakeholder of the university, which is our students in their respective campuses. Prof, the year 2020 has been a very challenging year with lots of complications and challenges that are caused by the COVID-19 pandemic. Yeah. We had read and seen our close friends, neighbors, families, and loved ones succumbing to the pandemic. Hospital beds have been interchanging people of different age groups and races, where some were able to go back to their homes still breathing, and some went back to their homes in caskets and lifeless. We have seen the dangers of this pandemic and the negative effects that it has on people living with chronic diseases. We have seen and read on the impact that COVID-19 has on our elderly people that we as students have left at our homes, and we are soon to go back to our homes for December holidays. We have seen the damage that was caused by the first wave of COVID-19, which has led our country into a very bad economic standing and has seen a greater number of our people losing their jobs and having their businesses being closed. Currently, Prof, some places are experiencing the second wave of COVID-19, and I best believe that the University of KwaZulu-Natal community will continue to do everything in its powers to ensure that it does not contribute to the second wave. Our campuses are flooded with posters which are raising awareness on COVID-19, the importance of sanitizing and wearing a mask in our campus spaces. Furthermore, upon entrance to our university premises, risk management security guards have their mask on with their hand sanitizers that should be utilized by everyone that is entering our campus spaces. What we want to emphasize to our students as an SRC, we want to ensure that in our campuses, we will make wearing a mask something that is very fashionable. And even in our residence spaces for the protection of our fellow students, the protection of ourselves and the protection of our staff workers who happen to be our parents. The pandemic affects us all, and we all must play our part in ensuring that we protect each and everyone within our spaces. We should always remind and encourage each other to put our mask on. We should report spaces or places that do not have hand sanitizers in our campuses or spaces that we are exposed to. In spaces that are crowded, we must also report those spaces to the risk management service, as to say that there are spaces that have a greater number or large gatherings in order to minimize the spread of COVID-19. In spaces where there are no breathing spaces or there are no windows that are open, we should be the very first people that should stand up and open windows and open doors so that you could allow air to come inside in those spaces that you are exposed to or that you are chilling in. This is for the benefits of all our students and further of benefits to our parents and communities that we are soon about to go to in our different places of origin. Therefore, we need not to carry the virus with us, as some of us come from the poorest communities without any proper health facilities that can assist in fighting the virus. We as the SRC, we would like to plead with the UKZN community to adhere to the National Coronavirus Command Team rules and regulations that have been placed in order to prevent or mitigate the spread of COVID-19. We plead with our students, populace, to wear their mask at all times, to always sanitize their hands, wash them regularly, and always keep a safe distance at all times in residence spaces and even in our campuses. We also would like to thank all students that have been adhering to the rules and regulations. We further would like to plead with them to motivate other students to also adhere to the regulations and the rules. What we most definitely know and what we best believe in is that working together, we can be able to beat this pandemic and go back to our normal lives that we are all longing for. We will go back to our SRC developmental and social programs that we always host in our campuses for the development of our students. But all of that, it's all in our hands, and it's all in us encouraging and motivating each other to keep a safer distance, to wear our masks, to sanitize our hands and wash them regularly in order for us to stop the spread of COVID-19. We further would like to thank the different departments that are involved in fighting the spread of COVID-19, from Department of Student and Residence Affairs by providing masks and sanitizers in our residences, to corporate relations for always updating us and our students on the spread of COVID-19 and where there could possibly be outbreaks, and also how can they be prevented in our residence spaces, and for all the posters that are posted in our campuses, gates, and our residence spaces. We as the SRC, we are committing ourselves to this greater cause of fighting this pandemic. And we are saying to all departments that are available and that are fighting the pandemic, that our doors will always remain open if there is any way that they would like assistance from us. We are willing to offer that assistance in any way possible, and we are also willing to come on board and assist in fighting this pandemic to ensure that our students are safe, staff members are safe, and all the other involved stakeholders. We commit ourselves into fighting this pandemic. With that being said, thank you very much for this opportunity that has been afforded to us again, and we continue to pledge ourselves and provide our availability to any means or any programs that seek to address our social issues that we are currently facing or that we are facing in our everyday lives. We thank corporate relations for the invite and all the stakeholders that are involved. Thank you very much.
Mr. President, thank you so much. You have no idea how grateful we are for your words of support, and also because as student leadership, you are the ones who are really going to be effective in mobilizing. We have nearly 20,000 students in our residences at the moment, and you know, you guys know exactly what needs to be done to make sure that we can promote this prevention measures in all our residences and work closely with our campus health. So thank you so much for joining and pledging your support. We look forward to working with you.
Thank you very much, Prof.
Thank you so much, colleagues. I would like to see if there's any urgent questions that we need to address. We are a few minutes over time, and I would like us to come close to draw towards a close. And in doing so, we can then be able to go ahead. I would like to invite the panelists also to make themselves available so that we can be able to address some of these questions and to also give closing remarks. I've looked at the questions, and it looks like the main question is whether there are any particular types of masks that we need to be looking at. And we don't have many other major questions. I think people are also just providing testimonies of what is happening there, expressing their concerns about the different campuses. But our occupational health nurses and people who are in charge of those campuses will help us to pay attention to those issues. Let me invite the panelists to give a round of comments for wrap up, and then address some of the questions that are raised as they respond. I'll start with you, Dr. Msomi, to take comments and address any of the questions that are relevant to you. Thank you.
Thank you, Prof. Mshabela. I would like to thank the fellow panelists that have been part of this webinar today for the very informative and insightful information that has been shared. And I hope we will all definitely put our hands on deck and fight this epidemic. I'm available to take any questions that may be directed to me at this point.
Thank you. Richard? Dr. Lesos?
Yeah, just thanks for putting this webinar on and for asking me to contribute, and thanks to the leadership shown by everybody, the Student Representative Council and the university in taking this issue seriously. And I think I come back to a comment I think Dr. Msomi made at the beginning, and you also, Mosa, that I think all of us on this panel are very much of the view that we don't subscribe to this blaming of people for spreading the virus. And what we try to do is to give people information to allow them to understand how this virus spreads, what the consequences of the virus infection are, and what we can all do individually and collectively to break chains of transmission and to stop it spreading in homes, in our communities, and widely in the country. And nobody can be blamed for spreading the virus, because this virus, unfortunately, is incredibly easily transmitted. But if we all have information, we can all do our best and do our bit to contribute to prevention of transmission, and that's what's important.
Yeah.
So
any comments on the type of masks?
I think there are. I mean, the government has got clear guidelines about the kind of specifications of the masks, and maybe we need to ask Norma to place that document. I can resend it, and maybe we need to make that more available to people, because we do understand a little bit more about what's important for the mask and what the kind of ideal characteristics are. And I take the point that somebody's made about it. It is difficult, and especially if you wear glasses like me, it's sometimes awkward, but somebody else posted a solution to that problem of the glasses, and there's other kind of simple measures one can take to reduce that.
Yeah, thank you so much. Sister Jabu?
Thank you, Prof. I would like to thank all my colleagues on the panel for sharing all the information you shared for our university staff and students. And I would also like to thank all our university staff and students who has been following our health and safety measures to ensure that we fight the spread of the COVID-19 in our campuses. And I thank those who has not been following in advance for following, because I'm sure after this webinar, they will start following all our health and safety measures that are in place. Thank you.
Thank you so much. Dr. Major, I'm going to give you the final word before I hand over back to Ms. Zondo.
Thank you so much, Program Director. I think what I wanted to highlight is the fact that no one is immune to this disease. You can get it. As young as you are, you can get it. As fresh as you think you are, you can still get it. And then also, you can once you test positive, you can still test positive again. So don't think that now I've tested positive, then it's December time to me, and then I can just not wear a mask because I've had this disease before. You have to still continue to use the mask even after you've survived it. And also, don't say that since Xoli survived it, I will also survive it, because our immune systems are not the same. So I might survive it today, but then you might not survive it. And also, I think I would like to thank the university. Everything that they have done is very positive and also contributes to the scourge of this virus. So I think what we need to do is continue to follow the university protocols. I remember that when I tested positive, I told my line manager as the university protocol, and then Sister Jabu contacted me as well. And then that constant communication within the university is very helpful when you are faced with this virus, because you need people's presence, people who are going to tell you, you are going to be okay, you'll be fine. I remember at some point I was actually laughing with Sister Jao that, I thought that I was not going to make it this morning, because you worry a lot at night, because you might not wake up in the following day. You don't know when it's going to end with you when you have the virus. So you are constantly worried. So then when a person calls you during that time, it gives you enough energy to stay alive and still stay positive. So with those words, thank you so much to the university for contributing to our community in its entirety. Thank you.
Thank you so much, Dr. Majola. Ms. Nauma Zondo, I'm handing back to you so that you can wrap up as we go towards a close. Thank you so much, colleagues. I also want to thank all the panelists and all the students that have been part of this. Thank you.
Thank you, Professor Mashabela. Just give me 1 second, I need to close this. So I had to have 2 screens because I kept on losing network. So, but it looks like everything is fine now. Thank you so much to all our participants for taking the time to be with us this afternoon. To our esteemed panelists, I would like to express our gratitude to you for accepting our invitation. You really did a great job this afternoon. Dr. Msomi, thank you so much for giving us an overview of what is happening globally and also in our country, and more closer to home, our KZN province. Dr. Lessels, thank you for reminding us how the virus spread, and also for the update on the outbreaks on campus. And hopefully we won't be seeing more of those anytime soon. Sister Thope, thank you so much for sharing with us what's happening on the ground, and for what the campus health team is doing to keep our students safe and our staff, and the measures that have been put in place to make sure that we curb the spread of the virus. To Dr. Majola and Mr. Msezane, I think he is already gone. Thank you both for sharing your experiences with us. We really appreciate and hope that people will learn from your experience and take this virus seriously. I'd also like to thank Mr. Gambako, the president, for always availing himself for your support, and also for calling on our student body to come together and join us in the fight against this deadly virus. Lastly, I would like to thank our facilitator, Professor Mashabela, for doing a fantastic job on this program this afternoon, and also for always being available to lead the way in the fight against coronavirus. Ladies and gentlemen, the message is clear. We need to make sure that we need to make sure that we don't drop our guard. The resurgence is here, so we cannot afford to let down our guard at this point in time. I just received a message shortly from one of our colleagues saying that they've seen they've just been on Howard College, and students are not wearing masks, yet our RMS at the main gates, they have confirmed that many students are masked when they enter the campus, and then they remove their mask immediately thereafter. So, this is actually a behavior that, it's not accepted. We really need to make sure that we keep our masks on and avoid putting other people at risk. Students, when they were invited to come back to campus, there was a list of protocols they needed to follow, and they also signed a code of conduct that was even also emailed to them to make sure that they don't drop the ball and also keep following protocols. So let's do that and make sure that we stay safe, and let's keep distancing, washing our hands, and make sure that we in spaces that are well ventilated, as one of our speakers said, and to keep those windows open at all times. and make sure that we stay safe. Thank you so much to everyone who was here, and we really appreciate your support. We're looking forward to seeing you back in the new year, healthy and safe. And make sure that you don't transport the viruses back to your communities and bring it back to us. We really want to go back to normal now. We are really, really tired, but I mean, we still have to keep safe until the vaccine is found. Thank you so much, everyone. Have a good evening and enjoy the rest of your evening. Thank you. So for those who want the slides and so on, this presentation or this webinar will be available on our YouTube channel afterwards. We were broadcasting live as well, so it will be available there. But people who want specifically the slides, then we'll have to request our presenters to share the slides that they want. So thank you so much, everyone. Thank you for being with us this afternoon.
Thank you. Bye-bye.
Thank you. Hi, Rakshika.
Hi, Norma. I'm
Hi,
ending
Ray.
it now.